Now let's bring in Dr. Aditi Nerurkar, a physician at Harvard Medical School. Good morning, doctor. Now, we just talked about the effects the pause on J&J distribution is having in Michigan. Now, that state is seeing the highest rise in cases in the country. But how do you think the pause is affecting the U.S. as a whole?
It's a great question. You know, we are going to see Johnson & Johnson at this time. It supplies about 5% of the vaccines in the U.S. So we're not going to see such a big impact with vaccine supply. We know that with Moderna and others, we're seeing a ramp up. Each vial of the Moderna vaccine, for example, is 50% more doses. So we're going to be able to make this up. It's not going to be a supply issue in the long term, but certainly in the short term, it is a big issue.
Now, in Europe, Poland is actually going to keep administering the one-shot doses on the premise that the benefits outweigh the risks, which we've heard a lot about. We know that we're hearing it's more likely you're going to get COVID or get a blood clot from COVID than the shot. But what do you think about that move?
That's actually a very smart move. You know, there's various countries in the European Union. The European Medicines Agency has left it up to the individual countries to decide. So countries like Germany and Spain and Italy are rolling out the Johnson & Johnson vaccine to those over 60, and in France and Belgium to those over 50. We may see something similar happening in the U.S. after the April 23rd CDC meeting. Having COVID increases the risks of these blood clots by 100-fold. So when we do the risk-benefit ratio, it is a good idea to give the Johnson & Johnson vaccine to prevent the risk. You know, the risk is very, very low, 6 cases out of 7 million, compared to the risk of getting COVID and the 100-fold increase that we can see with these clots.
Doctor, I want to now talk about what's called breakthrough infections. That's people who actually end up getting COVID-19 after they're fully vaccinated. 5,800 fully vaccinated people have gotten COVID-19, but I want to keep in context that's out of nearly 77 million people. So this is actually good news. And those people who got it were mostly asymptomatic or mildly symptomatic, which basically makes it sound like this is working. But how sick are these people getting? How is this happening if they have been fully vaccinated?
That's a great question, Savannah. You know, no vaccine is 100%, and 5,800 cases out of 77 million, like you said, is a great statistic. The goal of the vaccine is to prevent severe illness, hospitalizations, and death. And like you said, most of these people who have gotten COVID after being fully vaccinated have very mild symptoms or no symptoms at all. This is a positive sign. It tells us that the vaccine is working, and it's something to be expected. No vaccine is 100%.
That is all great news. Dr. Nerurkar, thank you so much.
Thank you.